Well, joining me now as we commemorate World AIDS Day is Dr. Cesar Nunez. Dr. Nunez is director of the UNAIDS New York office. Welcome to the show.
Glad to be here.
Now, it's been 40 years since the first cases of what would eventually become known as AIDS were reported in a medical journal, and it's currently referred to by the WHO as a global endemic versus a pandemic. But how have attitudes towards people affected by HIV and AIDS evolved over the years?
I believe that the report that we issued for World AIDS Day 2021 summarizes it in one word, which is inequalities. We see these inequalities generating gaps. And the report that you just showed us in Uganda, you can see how particularly COVID has come to demonstrate that we are actually in the face of two pandemics that are colliding. And the common denominator is inequalities. Have people that do not have access to the medicines or to the therapeutics and diagnostics in some instances at country level. The health systems are struggling, mostly put at the test because of the COVID pandemic. We, in this report, make a call to leaders around the world to make sure that those gaps are filled in by legislation, filled in by more opportunities for communities to be engaged, and certainly more equitable access to medicines and therapeutics.
So how much would you say has changed in terms of progress, new cases, and the most affected communities before versus after the COVID pandemic?
I believe that we were already behind before COVID jumped in, but now we're even staying back further. I have to be positive as well. There are many countries that have demonstrated that they have moved forward in their response. Good access to therapy, the death rates are going down in countries where people have access to medicines, but prevention is still limited, and we still see the new number of cases going up. In 2020, our report calls a 1.5 million increase in the number of new infections. And in the terms of deaths, you may see that COVID has killed 1.8 million people in 2020 and 1.8 million people already in 2021. HIV in 2020 killed 900,000 people, so about half of those. So it is still a very important pandemic amongst us.
And it can be difficult, obviously, with so much focus on COVID. You also have a lot of people putting off some of their regular health screenings like mammograms and their checkups because of COVID. What are the key ways that the pandemic has affected HIV and AIDS diagnosis and treatment?
Our recommendations go for strengthening of the health services, make them as horizontal as possible. Number two, something that has worked for HIV, the engagement of communities. Communities can support or work together with governments in terms of leading efforts, reaching out to those who may need diagnostics or treatments. Additionally, supporting the workers, the health workers who are actually the front line in the response. They need to be well trained and they need to be well equipped. And finally, I believe that data that can be as granular as possible so that we can target, with the limited resources that we may have, the places or the populations that are in most need. At present, we are concerned about key populations which represent the highest proportion of new infections and most affected around the world.
So then, given a lot of these inequities, as well as some of these correlations between research for COVID and AIDS and HIV, how likely is President Biden to reach this 2030 goal for the U.S.?
I listened to President Biden's remarks this afternoon. I see, first of all, political commitment, and political commitment that goes with resources side by side. We need to see that same kind of leadership all over the world to make sure that not only we have the narrative, but we have the resources that will help tackle HIV, COVID, and any other future pandemic that comes to us in the future.
Well, thank you. It's been wonderful having you on. Dr. Cesar Nunez there, Director of the UNAIDS New York office.